As a valued NEI podcast listener, get $100 off NEI Fall Congress registration with code POD26. That's POD26. Go to nei.global/fall, FALL, to sign up today. Early bird rates end on June 30th. Register early before it sells out.
Welcome to the NEI Podcast. On this show, psychiatrist, psychopharmacologist, and chief medical officer of NEI, Dr. Andrew Cutler, sits with renowned mental health experts from a range of backgrounds to discuss breakthroughs and best practices for treating patients with mental health conditions.
Hello and welcome to another NEI Podcast. Today we're talking about a topic that we always get a lot of questions about, and there's a lot of confusion out there. With me today is Dr. Bhagwan Bahroo, and that name might sound familiar to you because those of you who are NEI listeners and attendees know Dr. Bahroo's son, Dr. Laxman Bahroo, is a neurologist and on the NEI faculty. Dr. Bhagwan Bahroo, however, is a psychiatrist, and I'm thrilled to have you here today. How are you?
Thank you. I'm fine, thank you. And it's a pleasure, and I thank you very much for inviting me today for this exciting session.
Absolutely. Now, we're going to be talking about nutritional supplements and nutrition and the role in mental health, not just physical health. And you are an expert who has extensive experience in Washington, D.C. at the Walter Reed Military Medical Center, also at the University of Health Sciences Center in Bethesda, Maryland. And you've done a lot of work with TMS and ketamine, but also interest in nutrition. So let's get started with when patients ask about nutrition or supplements for depression, what are they really looking for? Why do they ask about that?
It's an excellent start of a question. What are the patients looking for, in fact? They're looking for, when they're talking about nutrition, they're not really talking about food. They're talking more about agency, autonomy to decide what they want to do, and what is safe, what is natural, and what is aligned with their values. Many of them come with frustrations about medications and the side effects, and often nutrition becomes a way to reclaim some of that control back. They often ask, what should I eat? What should I consume to help me with my depression? People tell me about supplements. Are those good? Are those not good? What can you tell me about it? On the other hand, the other part of that equation is the clinicians. And clinicians tend to either under-respond or over-respond.
What do you mean by that?
Let's take an example of under-respond. We clinicians have not learned much about nutrition when we were in medical school, unless we come from medical school in the 60s and 70s. That time, nutrition was taught. And then it was taken out of the syllabus because biochemistry took over. So today's nutritionist is a separate category altogether. As doctors, we don't know much about nutrition, and what we tend to do is we tend to dismiss it and say, okay, there's no evidence. All these supplements, all these herbs and spices that people talk about, there's no solid evidence. So what can we tell you? Of course, that doesn't help with the therapeutic alliance because patient is looking for an answer and the doctor is not giving one. On the other hand, just to please the patient and say, okay, we are doing right by him, we'll give him all the supplements that are out there. But we do not know which supplements are good and which are not, which interact. There are some supplements which are definitely dangerous because they interact on the P450 system, and that can be a problem.
Certainly. You know, that's interesting you say that. I think we don't talk enough about drug-drug interactions. We think that nutritional supplements and herbs are safe, if you will. So that's an interesting topic.
They are natural, but not necessarily safe.
Oh, that's a good distinction. I like that. Well, I guess what you're saying is that there are some of these that are evidence-based. Is that correct?
Absolutely. There are plenty of good supplements. In fact, the one that comes on the top of the mind. In fact, if you could divide supplements, there are those that are proven safe. There are those who are still in that middle stage, the twilight zone, and there are those which can definitely hurt. Let's talk about those that are very safe. First category is that of fish oil. Fish oil has known time and again to be good, particularly the omega-3s. And even in omega-3s, there are two types. There is the EPA and then there is the DHA. The ratio, generally, we look for at least double the EPA to the DHA, which means 2 to 1. Of course, 3 to 1 or 4 to 1 is even more beneficial. So that's definitely what we can say as yes, something that is safe, something that is definitely good. Then there is another part that we often forget is that many of our antidepressants don't work because there are deficiencies of other elements in the body. There could be folate deficiency, there could be B12 deficiency, there could be iron deficiency. A person is having anemia. Antidepressants don't work if they are anemic. And then, of course, the biggest one of all is vitamin D. Some of the SSRIs have been known to reduce the absorption of vitamin D in the gut. Go figure.
Yeah.
How many times do we actually do vitamin D levels on patients? Me, I do it every time I send them for CBC and CMP. I need to know if the vitamin D level is good. If, on the other hand, vitamin D level is down, I bring it up. My work is done. And there's another part to this, and that is the vitamin D. Unfortunately, in the zone that we live in, the temperate zone in the United States, we don't have much of it. More than half the people are walking around with low vitamin Ds because there's not enough sunlight to go by.
Yes, right. But even as we age, I understand, you still may not get enough from sunlight even
Exactly.
if you're older. I live in Florida, for instance, and I actually had my vitamin D tested and it was low. So I took vitamin D supplementation.
Go figure.
I still do, yeah.
A Floridian telling me his vitamin D is low. What about the one in New York or Maine?
Exactly, that's right. You know, fish oil is also very interesting. There's all kinds of evidence about the effects on the heart and beneficial for cardiac conditions.
Yep.
People know this, and lipids. But it's also good for the brain, as you've said. Yeah. So are there other, obviously vitamin B12 and folate, we're all aware of that. And there's even some L-methylfolate preparations that people use.
Yep.
There's one that's FDA cleared, Deplin for depression augmentation. And that gets me to a question, should we be thinking of these by themselves or as adjuncts? What's the evidence and the way you would think about that?
Definitely. That's a very important aspect of treatment. These come as adjuncts, never as primary, never as replacement of medications. There is a group of people out there who believe that these medications, these supplements are enough. Absolutely not. Science has proven again and again with solid evidence that medications are the first line of treatment with the help of supplements if needed, and particularly if there is a supplement that is needed because it is deficient. The other aspect of this is not only supplements but even diet. There are people in nutritional psychiatry who believe nutrition can replace everything. I am not of that opinion. I definitely believe nutrition being part of our lifestyle can make a significant dent in the treatment, but after medications have been given. So the two can run together parallel. And nutrition, good nutrition, that which is anti-inflammatory, that which helps with the metabolic health, is of paramount importance.
Of course, in America, we know there's a lot of fast food and processed foods, and people don't always eat enough whole foods and vegetables and fruits and things like that. So what should we be telling our patients about diet?
That brings me, let me give you an example of a patient I just came about. He's in his mid-40s. He has a mother who has taken over the kitchen because she's OCD, and she would not allow her son to come into the kitchen because he's messy, as she says. He goes out to eat. And when he goes out to eat, guess what he eats every day? Fish sandwich? No, hardly ever. He goes for chicken sandwich and hamburgers. And I asked him a question. You're surviving on those? Oh, I love them, doc, is his answer. And I tell him, when was the last time you ate a salad? Those same places you eat chicken sandwich also offer salads. He said, nah, I'm not an herbivore. I'm an omnivore. So that is the situation today. We should be telling our patients that yes, you can eat what pleases you. There's always a little bit of accommodation to be given to the palate. But at the same time, if you do not eat right, then you're doing yourself a disservice. And by that I mean Mediterranean diet, whole food diet, diet that is anti-inflammatory, diet that does not worsen our insulin resistance, diet that doesn't increase our lipid levels, doesn't increase the inflammation. All that has to be taken into consideration. Currently, we have solid evidence. Mediterranean diet is the best there is. But following in its footsteps, there are other two diets which are coming into prominence. One of them is from Okinawa. Okinawan diet is also considered good in a different way, but definitely anti-inflammatory. And now there is talk about a Norwegian diet. Yeah. And finally, this you might find interesting. There's a group of people who have come up with a combination of Mediterranean diet with spices from India. And they call it the best diet because what could be better than having those spices and herbs in the Mediterranean food? Of course, I have to correct myself and say scientific evidence has not been proven yet. Time will tell.
Sure. Well, I have to confess, I love Indian food. I love the complex spices. But as you said, some of these spices have data on anti-inflammation, turmeric, for instance, and some of the other spices that are used. So that's certainly interesting. What about people who say, well, I can't eat a salad and I just take a multivitamin? So is there any evidence that taking vitamins would help make up for this?
What has happened is there has been a lot of hype about multivitamins being antioxidants. The two words are not synonymous. There are antioxidants which are beneficial, but then not all multivitamins are beneficial from an antioxidant point of view. And if you already have enough of water-soluble vitamins like vitamin B and C, overdosing them will not help. All it does is just gets washed away in your urine. So you might be paying a lot of money for something that's absolutely of no consequence.
Nice. So that's a question I had, of course, is what are some things that people are taking that don't have good evidence, maybe? And I guess one of them would be water-soluble vitamins if someone's not deficient in those. But what other kinds of things?
I will tell you that there are my patients who come with a boatload of things that they are taking. In fact, some of them I genuinely worry about. The one I worry about most is St. John's wort. St. John's wort is by itself supposedly a good one, and many ancient primitive tribes still continue to use that. Those who do not have access to or do not even know about the modern antidepressants. But on the other hand, they also work on the P450 system, which means if you're adding it to already an antidepressant that's with you, what you're doing is you're going to be ending up with either a noradrenergic crisis or a serotonin syndrome. I can't say which because I don't even know what St. John's wort is going to come from. As we say, it's not the same the world over. The composition might be different where it comes from.
Right. Yeah, St. John's wort is, of course, not regulated, not necessarily pharmaceutical grade, so you don't know what you're getting.
Even
what you're referring to is it can interfere with some of the cytochrome P450 enzymes, I believe 3A4 in particular. And also, St. John's wort does have some monoamine oxidase inhibition activity, I understand, which we know the issues there could be with traditional antidepressants. So that's a very helpful, very good
There's one more that comes to mind, ginkgo biloba.
Oh,
a lot of my patients say, it improves my mood, gives me this whole clarity, my cognition becomes better. I said the same thing could be achieved with a cup of tea or coffee. In fact, many patients of mine who have ADHD, when they feel the medication is not working enough, they supplement it with coffee. And they say it gives me clarity. Of course, we all know what coffee contains, caffeine.
Caffeine's a stimulant, of course.
Exactly.
Yeah. What's the risk of ginkgo biloba, though?
The risk of ginkgo biloba, again, the same thing. It works on various enzymes, P450, And while it is by itself a good substitute in some cases, and I mean in some very rare cases, I wouldn't go about saying that, yes, add it to your medications and you will do better. We do know that ginkgo biloba is good for cognition per se.
Yes. There is some evidence, too, though, that it can interfere with blood clotting. It can have a blood thinning effect. And there have been some case reports, unfortunately, especially in older people, it bleeds into the head.
Oh, yeah.
So we do have to be careful about that. And especially if you combine that with a serotonergic antidepressant,
Yes.
which also interferes with clotting, there's a
And
risk
the
there.
biggest problem in all these is the formulation. Who is marketing it? Is it coming from CVS, GNC, or some other store? Are they all of the same standard? There is no gold standard in any of these herbs. We do not know what the gold standard is. Is it 1 ounce of it, 1.2, or 10 ounces?
Right.
No
They haven't-
studies have been done.
Yeah, they haven't been studied systematically, so we don't have all the dosing worked out, if you
No.
will. The studies aren't done looking at drug-drug interactions very well, so we don't have a lot of good guidance on them. Another one I want to ask you about is N-acetylcysteine, NAC. I have heard some people using that.
Yes.
What's the word on that?
Oh, you'll be surprised. I have used it too.
Ah, okay.
There are some patients who are going all the way high up with their SSRIs and have severe OCD, which is not controlled with any of the SSRIs, even in their highest doses, to the point where now it is becoming intolerable. And adding this item has really made a dent. It is funny because, again, the documented evidence is not adequate. It's not solid. But anecdotally, I have found that to be of benefit. But I would not recommend it to just add everybody adding it as an adjuvant. No, it's only in cases where I have seen that the SSRI by itself, having gone to the highest tolerable dose, has not helped. I have added it and it has helped.
Yeah. It's interesting. N-acetylcysteine, some people may know it as Mucomyst. It's used in the ER for acetaminophen overdose.
Yep.
It's a very potent antioxidant,
It is.
actually, and it's not just helping the liver, it can help the brain.
Yep.
And there is a database for trichotillomania and OCD at high doses, 4 grams and above.
Yep.
Unfortunately, the dose we usually see in the store is 500 milligrams or 600 milligrams, so you do need to take a higher dose probably to get the benefit. But
I am quite cautious because, unfortunately, the verdict is not out yet completely. The evidence is good, but not excellent. There are some cases where it has found to be not so useful. So I treat it on a case by case. Every case is individual, and I have to make sure that I have done the right homework before I go ahead prescribing this medication.
Well, my understanding with N-acetylcysteine is there's not much data for depression, but as we said, for OCD, trichotillomania, and even for traumatic brain injury,
Yes.
there are data for that.
I forgot to mention that, yeah.
That's okay. So, thinking more critically about where some of these supplements make sense and where they maybe not is another way to think about this. When we're looking at the evidence base, how do we evaluate the data and the evidence? Because sometimes there's case reports and we get a lot of hype around these things. What's the best way to look at this?
Unfortunately, what has happened is word travels fast. And in these days of more social media, everybody has an opinion on medications. And some of it may be partly helpful, but most of it I found is just plain hype. So much so that somebody tried something and for whatever uncontrolled reason it worked. Now it is the best medication that there ever was created. And because of that, what has happened is a lot of good information has not come to the forefront. And we are left with whatever people say. And Dr. Google, of course, was always Dr. Google, but now we have AI to add to it, which is adding more and more hype.
Yes, confusion, unfortunately.
So in this, all of it, there are a few caveats which I always follow. One of them is I always ask a patient, give me a typical day what you eat. Without that, my intake is never complete. My intake has to include a question about nutrition, about sleep, about connectedness, about various other life activities besides it. So in order for me to ask that question, I cannot be asking, give me the whole menu that you ate for a week. That would take forever. But I can always ask a question, give me a typical day what you ate. What time did you get up? What was your first meal? Was it breakfast? Was it lunch? There are patients of mine who say, no, we are in a hurry. We take a cup of coffee and walk away. We come back at 4 in the evening and then have one heavy meal. Is that the right way to do things? Biologically, I can't say for sure because there is no standard, but we know that conventionally we eat 3 meals a day. And those 3 meals, we have to make sure we eat right by starting with a protein-rich breakfast. That's an important meal of the day. Then we come to lunch and dinner and we have to think about how much greens are we adding? Are we adding any seafood, fish or not? All those things count.
Certainly. Well, you raised an important issue. We've heard a lot about the intermittent fasting diet where people don't eat for a certain part of the day. There's some evidence. There's evidence about this ketogenic kind of diet and so on. What are your thoughts about that?
It works for some people quite well. In fact, if we take historical aspect to intermittent fasting, it has been in existence for thousands of years. Not the words intermittent fasting, but there are cultures where I grew up with where it was considered. In Jain religion, they go for fast for 28 days. I don't know if that's called intermittent anymore. Then there are certain cultures in the Middle East where they do not eat during daytime for a whole month but only feast at night. Is that intermittent fasting? There's another way, but intermittent fasting has been around forever. Personally, I'm not a huge fan because my constitution doesn't allow me to do that. I get headaches when I'm hungry, which I cannot handle. But on the other hand, there are people I know of who do wonderfully well with intermittent fasting. They've maintained their weight, their lipid balance is great, their insulin resistance is wonderful, and they swear by it. They say yes. So to each his own. There are people who would absolutely benefit from this intermittent fasting. Whether the intermittent fasting is skipping 1 meal a day or skipping 2 meals and going for 1 meal a day or doing it every alternate day or even doing it once every week or 2.
Yeah, I guess what works for you is kind of what you do. What about the ketogenic diets with very low carbohydrates or even some people who are eating a lot of meat and not much else? What do you think about those?
That could be a problem. You see, our bodies are made for us to have an adequate amount of carbohydrates, proteins, and fats. Concentrating on one thing and not paying attention to the other two can create a problem. Ketogenic diet theoretically sounds fascinating. However, if you're not having enough proteins, are you going to miss out on essential amino acids? If you're not eating enough carbohydrates, how many people know that all our cell membranes are made of carbohydrates? What happens when we don't get enough carbohydrate and too much of ketones?
Right. Well, I guess the issue is that there are better carbohydrates and less good carbohydrates. And
certainly,
I guess, in our society, we've overdone carbohydrates and especially sugars and processed foods. So it sounds like this is a reaction to that, and maybe the pendulum swings too far sometimes.
Oh, yes.
Yeah.
Refined sugars have been time and again told are bad for our bodies and for our brain. Wholesome carbohydrates, complex carbohydrates, the ones that come with whole wheat flour, those are considered standard and good, not the refined sugars, because there's a difference between complex carbohydrates which take a long time to digest and they digest more uniformly versus sugar which just gives you a spike in the blood and it's gone. And you know what spikes in blood do, particularly in ADHD, while the theory has been debunked, still the sugar spike can produce a reaction in the nucleus accumbens, where the reward center is.
Right, right. Yeah, and then you get into a vicious cycle, in a sense.
Yeah.
People are too pleasure-seeking kind of thing. At what point do you think about shifting from supplements to diet, or how do you incorporate discussions of both supplements and diet into your evaluation of a patient or your managing a patient?
To me, both have certain significance. However, if you think in terms of supplements, they are easily dispensable because easily available. Diet, on the other hand, becomes an individual's choice. The results from diet are definitely higher than whatever you can get from supplements. So attainable results, objective results, definitely are better with diet. However, if somebody were to expect I'm going to get 100% better by eating a wholesome diet, then that would be expecting to have the moon in your hand. Even if you get 20 to 30% difference in your depression, that is a significant difference in your depression. To get that, you have to concentrate on diet more than on just supplements, because the diet, a wholesome diet, gives you just much more than what a supplement can do.
Yeah, that's true. There are data actually on an anti-inflammatory and high antioxidant diet helping people with cognitive impairment, even in older folks. So seems like that's a very reasonable thing to do.
And we haven't even talking about the microbiome yet and its role.
Absolutely. Let's talk about the gut microbiome.
Gut microbiome. It's a gateway to everything that goes on in our body. Way back in the 70s when I was a medical student, I was told gut microbiome is a parasitic organism sitting and doing nothing, and the more easily we get rid of it, the better. And today, in the last 20 years, has the world changed, and for the better? Today we have been able to identify the good microbiome from the bad microbiome. We even know that the gut microbiome affects our dermatological system, our immunological system, our endocrine system, our brain, and our mind. I mean, this is one organism, a group of organisms, as much as our human organism itself, trillions of bacteria and viruses in our gut who are influencing, in fact, I would go ahead and say, influencing what we eat, because they affect our appetite center. So we have to keep them in check. And how do we do that? By eating good food. If we eat good food, which is prebiotic, probiotic, symbiotic, and postbiotic, we've got it made. We've made them happy. In fact, they're going to turn around and make us happy.
I see. What are such foods? I mean, what is a prebiotic, probiotic? What are some foods to recommend?
So pre and postbiotic together are called, pre and probiotics are together called as symbiotics. So prebiotics are stuff that are available in the market and which will help the gut bacteria move in a better way. On the other hand, probiotics are those which are actually live cultures, which are seen in yogurt and other fermented foods. In fact, many of the pickles that are made in the market, even sauerkraut, for example,
Sauerkraut, I've heard,
kimchi,
yes.
All these are wonderful foods that help our gut microbiota. And postbiotics are the final products that are created, such as butyrate and other such stuff that helps energize the gut microbiome to be more productive, more efficient in influencing all the systems in our body.
I've heard a high fiber diet can also be good for the gut microbiome.
Absolutely. High fiber diet has a big role to play because with that high fiber, first of all, it is giving you a good motion at the end of the day so that what you're doing is you're never constipated. But that's the last step. Between that, it does many other steps. There are studies which show that people who have high fiber diet, in fact, reduce their cholesterol intake. When you're eating all that fatty food, if you had high fiber, not all of your fatty food will get absorbed, which means your cholesterol is now going to be better managed. And then, of course, there are certain organisms which thrive on these fibers, and from them they create certain vitamins and certain things, certain minerals, certain chemicals, which are helpful to our brain. So high fiber itself has many, many roles to play in our body.
Yes. And my understanding also is processed foods and refined sugars induce the wrong kind of bacteria in the gut.
They are the exact opposite of what we just talked about.
Yes.
Processed foods, deeply fried foods, foods that are processed. And this has only happened in the last 200 years or so, that we become more and more processed. Before 200 years, nobody knew of white flour. They used to eat whole wheat flour. Canning and processing are the two things that have changed our diets. Sometimes I go to the supermarket and I shudder when I look at the TV dinners that are out there. And if you read the ingredients, there is everything except good food in them. So these are what we have to correct. We have to go back to that original system. Of course, processed foods, they are quick, they are fast. In our fast-paced life, they fulfill a role for us, but the cost can be dampening.
Yeah, for the brain and the body, of course.
Yeah.
Okay, when we're talking about working with patients now, how do we incorporate nutrition into a treatment plan without overwhelming the patient or losing focus on the core treatments?
It's a very important point, because if I were to sit down and advise the patient all the things that I have in my mind, none of it is going to get incorporated. I have to make one change at every sitting. And that change could be, how about trying a handful of nuts instead of a fried snack? How about stopping those potato chips and adding a green that day? How about adding one vegetable per day in your diet? That's not asking for the moon. That's just asking for one small change. To me, one change per session per month makes a bigger dent than adding 5 changes at one sitting.
I see. So more of a stepwise approach, if you will, and taking a longer-term view. Almost you're starting a conversation rather than you have to close the deal right off the bat.
No, never. But I give them the expectation at the intake that if there are any changes to be made in your lifestyle, we will do them collectively, slowly, steadily, but changes have to be made in order for us to make the best of the treatment plan.
Okay. Now, how should we think about these issues when we're treating a patient on a psychotropic medication, especially those that may have a risk for weight gain or metabolic complications? Is there things we can do there?
That's a whole new ball game. When we are talking about psychotropic medications, especially the dopamine blockers, those medications which increase appetite, amongst them there's one called mirtazapine, which also we know increases appetite. And psychotropics, of course, all of them, most of them, we have known the weight gain that comes with it. Rather than wait for it to happen and then start talking about, my motto is, this has to be preventive medicine. It's very clinically important that the day I prescribe an antipsychotic, I have to start talking about changes in diet, changes that need to be done so that we do not deal with insulin resistance, we do not deal with high lipids, which of course later on, at best, he or she might turn into a diabetic and go on diabetes medication or get high cholesterol and go on statins. Well, if I can avoid that at any cost, I should do that today. Prevention is definitely better than cure.
This is a very interesting concept. I have to tell you, this may be new to some of our listeners, the idea of dietary intervention as a preventive measure rather than a reactive measure. I think that's fascinating.
And every patient on antipsychotic has to be counseled about the right foods to eat and how to monitor themselves.
Yes, and also, of course, we're not here to talk about exercise, but that should be incorporated into this plan
That's
as well.
all part of the lifestyle changes.
Lifestyle, yes. And you mentioned sleep, of course, paying attention to sleep. And you mentioned relationships and connectedness. I find that fascinating, too. How does that play into this?
If you remember, way back when we were in residency, there was always a talk on addiction psychiatry. And in addictions, we were always told that if you want to make a change in somebody's alcohol drinking habits, tell them the same old buddies will not help. On the other hand, the same goes for food as well. If you're used to eating outside with the same group of people, and this is particularly dampening in cases of seniors. If you ever visit a senior citizen home where they are passing their golden years in enjoyment, you will find their morning breakfast consists of donuts and coffee. And I keep wondering, when are they going to start eating good, healthy meals? How can donuts be breakfast? On the same level, when we talk about relationships, it's very important for the relationship to be supportive. Just like support is obtained for alcohol drinking, the same goes for medicines. The same goes for food. There has to be a collective family effort, at least an effort by the couple and by friends together. Let's plan to eat healthy. If we can't do that every day, let's start with one day in a week. And slowly we can progress. So I definitely believe social connections go a long way in that too.
Well, this is fascinating too. The idea of bringing the family, not just the patient talking about nutrition, bringing the family into this, because families often eat together and make choices of what restaurant they're going to go to and so on. Yeah, that's so fascinating.
Though we have to be mindful, there are people in this country who live in what is known as food deserts, where all foods are not available, or financial constraints are there which prevent them from eating really good food. However, good food, even if it comes at premium, should be our priority because that makes a big difference in our health. Would you rather eat a good carrot or would you rather go to the store and get vitamin A supplement?
I see, yes. Well, of course, the carrot gives you fiber and other things.
Exactly.
Yes. All right. Well, this has been a fascinating conversation. We could talk more, but I want to kind of wrap up with some final thoughts here. If you had to give clinicians a simple framework, when should they incorporate nutritional interventions or supplements into, especially depression care, and what would be some mistakes to avoid here?
Definitely. So, first of all, what advice to give to the clinicians who are seeing patients is, you will find some patients who are treatment resistant. And whatever you do for depression, nothing is working. Always keep in the back of the mind, am I missing something that I could have added, a supplement? Could I add fish oil? Should I give them nutrition advice? Should I check and make sure that all the deficiencies are taken into account? Vitamin D, vitamin B12, folate, iron, magnesium sometimes. Yeah, all these have to be taken into account. After we have taken into account, there's always those patients who are looking for more, who want a wholesome approach to their treatment, who are there for integrative psychiatry. They will at once incorporate whatever advice you give them in their day-to-day management. These are the patients, and then of course, there are patients who outright will come to you with obesity, metabolic problems, diabetes, high cholesterol, inflammation. Any neuroinflammation will avoid you from getting the best of your medication if you have not taken care of the inflammation. All these things are of utmost importance. So we have to treat the patient as a whole. We don't treat the gut microbiome. We don't treat the depression. We treat the patient. And when you treat the patient, you have to treat all aspects of treatment, not just medications. But we have to remember, medications have to be given. We cannot substitute other stuff and say, okay, take this in place of medication and you'll feel better. That is not good advice. So to me, the best thing to do is treat everything in its entirety.
Right. So the idea of holistic care here,
Yeah.
of course, is seeing the whole picture. And the best outcomes probably are holistic. We know, for instance, that the better outcomes from medication plus psychotherapy or lifestyle interventions and so on. So this is just another aspect of thinking holistically. Some of the mistakes I'm hearing you say, it sounds like would be number one, to kind of underreact and poo-poo things when people bring them to you. For instance, I had a patient recently who brought me a book about this specific ketogenic diet. There's a psychiatrist in Harvard who's pushing this really hard. Well, I wanted to be open-minded and learn more about this, and maybe there's something to it. And if it helps this patient to avoid, say, processed sugars, and, maybe it's not all bad in a way.
Some of these books, I will tell you, I have gone through them myself. They're written by lay people for lay people. They have not had much evidence-based backup to that, but it's just, as I would call, or you would call it, as a hype. Hyping up some products for their own benefit. In fact, I wouldn't put it past some of the companies that market these products as the best there is. In fact, I was at one of the pharmacy stores and I found something which said, high energy for the brain. And if you look at the products inside, I was shocked. None of them were scientifically proven medications.
Right. So yeah, the evidence base is not as good. And unfortunately, there's a lot of anecdotal, people tell each other stories, as you said, on the internet and so on. I guess another mistake I'm hearing you say is the sense that I've got to do it all at once. I really resonated with what you said about let's start a process and kind of take it one thing at a time. And I guess also thinking about, look, if a supplement is not dangerous and it gives the patient, you started this conversation, a sense of agency or a sense of I'm actively participating in the process, that may be a good thing.
Definitely. I mean, a supplement is, per se, it's not a bad thing if you give the right supplement to the right patient. And you have to identify which patient should I be giving this supplement or not. Of course, before giving that, I would definitely recommend a simple blood test to find out all the deficiencies and correcting those deficiencies. Then you're giving a supplement that's right on the dot, which you cannot mistake ever. Correcting their vitamin D, correcting their folate and B12, correcting the hand. What could go wrong there?
It is. Well, I would throw in, too, something I was trained to do to also make sure to check the thyroid. That's a simple thing that if you miss that, they're not going to respond either. So
in fact, yes, definitely. Thyroid has to be checked. Yes, every patient of depression, if you have not done a TSH, then you have done a disservice to that patient.
Of course, of course.
One major thing that I would like to point again, which I said earlier, is what is natural is not always safe.
Oh, yeah, that's a good one.
And I think that point needs to be stressed. Just because it is out there natural, it might be safe by itself, but look at it with this entire picture. If you're adding medications and something natural, make sure there are no interactions. And interaction is the worst thing you could ever imagine for a patient. Ending them in the ER for a serotonin system crisis or a norepinephrine crisis with hypertension, that's just not warranted. And of course, we have to be careful about antipsychotics and the effect they have on the metabolic health and neuroinflammation.
Yes, very good advice. And one final thing, you talked about looking at labels of some of these supplements. And one thing that cracks me up, I guess, is I've seen them say clinically studied. Well, that doesn't mean they're clinically proven to be effective.
Exactly.
They've been studied, I guess. So I think you need to read the labels critically and look at the evidence base critically, too, in evaluating these things. Well, Dr. Bahroo, I've really enjoyed our conversation. Thank you so much for sharing your wisdom of many years, your accumulated wisdom and practical experience. I think this has been very clinically relevant. Any final words for our listeners?
Yes, final words. Whenever you see a patient, start a dialogue on everything else that will be done besides medications. And I don't mean to shortchange medication. They are the primary reason why the patient is coming to see you. But add all the other advices. Remember There is a nutritional aspect of treatment. There's a sleep aspect of treatment, which we many times don't even address properly. There is also the sense of social connectedness. If we have not addressed those issues, a person might be lonely and depressed. His loneliness needs to go away so he is not depressed, besides the medications. Always address how much of smoking, how much of alcohol, how much of marijuana. Marijuana considered. In fact, I forgot to mention, I have read some reports, non-documented reports, where CBD has been told to be good for depression. Go figure, there is no scientific evidence at all. Yet patients come and tell me, oh, I'm going to try CBD. Those things all have to be taken into consideration. We treat the whole patient.
Very wise advice. Thank you again so much for your time and your sharing your expertise with our audience. And I want to thank you, the listeners, for listening. I hope this has been valuable information. And for more information about our other educational offerings, our products, our services, please go to the NEI website, which is www.neiglobal.com. And you can get these podcasts wherever you get podcasts. So please check out all of our NEI podcasts. And I want to thank you again, and good luck with your clinical work. And thank you, Dr. Bahroo.
My pleasure, Dr. Cutler, and thank you for having me on this session today.
Thank you for joining us for another episode of the NEI podcast. Please let us know what you'd like to hear more about by leaving a review. Don't miss another episode. Subscribe today. For more information about NEI and our premier educational content, please visit neiglobal.com.